I often get asked, what is binge eating and what can be done about it? Binging is defined as the consumption of a large amount of food, more than most people would eat under the same circumstances, associated with a sense of loss of control over eating. So it's different from overeating, which does not generally have an associated sense of loss of control. And that really is important to the definition of binging. And binge behavior in and of itself is not a diagnosis, in the sense that a large proportion of the population may binge at some point in their life, but only a small minority meet criteria for one of the two eating disorder diagnoses that are characterized by this behavior. And they are primarily bulimia and binge eating disorder, although you can sometimes see some binge behavior also in anorexia, in a subset of individuals with anorexia nervosa. And in binge eating disorder and in bulimia, the frequency of binges must be once a week or more. So binging less than once a week doesn't really meet criteria for a diagnosis. The other thing that distinguishes binge eating disorder is that binges are additionally associated with other characteristics, typically several of the following: eating till uncomfortably full, eating rapidly, feeling guilty, embarrassed, or ashamed of this behavior, and eating secretively or beyond satiety. What causes binge eating? There are many triggers, and they vary according to the individual, but typical triggers are what we call dysphoric or unpleasant mood states. Anxiety or depression are the most common, as well as feeling bored or being in circumstances in which one tends to binge, like perhaps your kitchen late at night. And we know that because this is a behavioral problem, the more an individual does the behavior, the more automatic or habitual it tends to become. And in that sense, the treatment for binge eating disorder must focus first on helping to interrupt the behavior and stop doing what you did yesterday, and understanding why you did it second, not first. Therefore, therapy should be very behaviorally focused. The primary modality of therapy that we use is what's known as cognitive behavioral therapy, which really is aimed at helping individuals normalize their eating, eat 3 regular meals a day, not skip meals, because skipping meals has been associated with binging in both human and in animal studies, or overeating, and eating a wide variety of foods, so not dividing foods into safe or risk groups based on fat or calorie content, but rather understanding balance within a meal in terms of the macronutrient types, and and understanding portion control. Besides behavioral approaches, there are a small number of medications that have been shown to have some efficacy in binge eating. Overall, behavioral approaches, especially CBT, has the strongest evidence. However, fluoxetine, topiramate, and lisdexamfetamine all have some support. Importantly, the data for lisdexamfetamine is limited, and that drug does have some abuse potential, so it should only be used selectively and for limited periods of time. Overall, there is not yet enough evidence to support whether the combination of both medication and therapy is superior, but certainly the first line of treatment, therefore, should be CBT plus or minus a medication.